G'day, my name's Trevor Young. With me today is Tim Andrew, who is one of the co-founders of the switching and comparison website splitit.com.au. We're talking all things health insurance today and Medicare rebates for next year. Tim, g'day mate. We're into the early part of June, coming up to the end of the financial year. What do Australians need to be aware of when it comes to June the 30th and all things health insurance?
Sure. As much as June the 30th, perhaps one of the biggest impacts is from July the 1st in the new financial year. What happens overnight that night is the federal government have brought in an income test for the Medicare rebate that you get on private health insurance.
So what does that mean? I mean, we're now means tested. Different people are going to fall into different tiers, I suppose. Is that the way it goes?
That's right. Well, so let me run through them. Just before I do, I'd say if there's a few numbers to remember here. So if you go to splitit.com.au, from the homepage, you'll find a link to a page that simply outlines these details on the table, and it's worth having a look through. So the key tiers to remember, and there's really four of them. There's the base one where there isn't really a change. And if you, as an individual, earn $84,000 or less, or as a household earn $168,000 or less, effectively you're not impacted. If you earn $1 more than either of those thresholds, then you'll be one of 2 million Australians who are. And there's a tier that starts at $84,001 up to $97,000, and double that for a household. If you fall into that tier, you're going to have a rebate of 20% instead of 30%. $97,001 up to $130 as an individual, and again double that for a household, and it drops down to a 10% rebate. And anything more than $130,000 as an individual and $260,000 for a household, and you get zero rebate in the future. So if you're in that top bracket, your health insurance is going to cost you 30% more next year, which is thousands of dollars.
That is a fair bit. So it's well worth people taking this time out to review their health and insurance, and obviously with splitit.com.au, that's a very easy thing to do these days.
It is. Well, you can get overwhelmed with the choice. We've actually got just on 10,000 policies for you to review on our site. We do make it really easy for you to find exactly what's right for you, depending on your life stage, and a couple of other questions about which state you're in. And those particular things that you're looking for, maybe physio or dental, are important things to you. And we help you very quickly narrow it down to just the handful of policies that are right for you to compare side by side. And the other unique thing about Splitit is, as well as having one of the broadest ranges to compare from, we also split anything that we make with you, any commission that we're paid, 50-50, and give you cash back.
So just explain that probably a little bit better. You use any commissions that you make via this health insurance. If anyone pays you, you're upfront about that this is what it is, and you're splitting that 50-50 with customers.
Yeah, that's right. So there's no hidden agendas here at all. It's just if we make anything, we split it with you and give you 50% of it. So
if you prepay, you're going to save potentially significant amounts of money. And also if you decide to go through splitit.com.au and there is a commission involved, not all of them are commission involved on the site, you'll get 50% of that as well. So there are some really good reasons why to at least be looking at reviewing your health insurance at this point in time.
That's right. So we've already helped some customers save by prepaying up to $2,000 and then given them an extra $500 cash back on top of that. So it's a significant amount of money, you're right.
It's unusual in these times,
that's right,
Tim,
absolutely,
to be getting anything back from anyone.
That's right.
All right. Thanks very much for your time.
No problem. Thanks, Trevor.
Cheers.